One of the best ways that you can actually leverage the marketing that you're doing for your dental sleep medicine practice is by having your administrative staff communicate with the administrative staff of referring physicians. If you yourself, the doctor, want to try and generate meetings with referring physicians, it's going to be very, very difficult for you to even step foot in their office, especially since COVID. A lot of them think dentists are driving outside their lane when trying to treat obstructive sleep apnea, so it's going to be very difficult to get those meetings. But administrative staff have a different relationship with one another. And if you can have your admin staff call the admin staff of a referring physician and just say, hey, we have 50 to 80 people reaching out to us every single month through our marketing efforts, inquiring about treating their obstructive sleep apnea. And we need to be able to refer them to an ENT or pulmonologist, cardiologist, whoever you're communicating with. We need to refer them to an office that we can trust. Is that a conversation you guys would like to have with us? And then the administrative staff sets up the meeting. There's no hard feelings there. There's no physician saying, nah, you're driving outside your lane. You need to mind your business and do some fillings and some crown preps. The administrative staff have a much different relationship together, and you're going to be far more likely to get that meeting if you have your admin staff communicating with the admin staff of that referring physician.